Today's topic is on integrated vector management. Um, so unfortunately, we are not able to do that in the earlier session. So let me continue now. So the contents of the today discussion is we'll see what are the principles of integrated vector management and what are the key elements and planning integrated vector management and planning and implementation of IVM. Under that, we'll just look at the disease situation, then local determinants of the disease, selection of vector control methods, requirements and resources, implementation strategy, generating an evidence-based vector surveillance, and finally monitoring and evaluation of integrated vector management. So regarding this principle, so the WHO has come out with 8 documents exclusively on integrated vector management. The first one is started with a strategic framework that was in 2004, and based on the framework and the recommendation of the committee, the WHO position statement on integrated vector management was released in 2008, which encourages the member states, that is all the countries, to initiate integrated vector management strategy for the control of vector-borne diseases. And in 2002, there was, the document on handbook for integrated management was released by the WHO, which gives all the details of how to plan, how to implement, how to evaluate the integrated vector management. Then also it is a new strategy. So we need to train the program managers at different levels, starting from the state and the district level. So the WHO has given the training curriculum on integrated vector management so that the countries can follow this to train the program managers for the control of vector-borne diseases. Also, it is a new strategy, so we need to have certain policy formulations at the government level so that this intervention, this strategy can be implemented for the control of vector-borne diseases, and WHO has given a guidelines how to make the policy decision for the integrated management. Then finally, when you have this program, then we need to evaluate it, whether the strategy works and the strategy is implemented properly, and also the strategy has certain impact on the vector-borne diseases. So these are the documents available, and you can get it, downloaded these documents for reference. So the next value, just to look at the disease burden. At the global level, for every 1 lakh population, this was estimated in 2017 for the global level, using a DALY as a summary measure. The DALY is a disability adjusted life years because it's a summary measure, because the diseases have different clinical outcomes. Some diseases cause mortality, some diseases morbidity, and some diseases disability. So that keeping all these clinical outcomes, the DALY is a summary measure which has been used to compare the diseases in terms of the burden. So the total DALYs for the diseases which are caused in human, it's about 2,503 million per year for every 1 lakh population. If you just multiply to the entire population of 7.53 million, it is huge. Then when you just look at the split up of the burden in terms of DALY by communicable diseases and other diseases, non-communicable diseases constitutes about 69%, and the remaining by the communicable diseases, injury, and vector-borne diseases. And the vector-borne diseases constitutes about 3% of the total burden. When you just look at the split up of the different vector-borne diseases in terms of the burden, malaria stands first. It's about 82%. It's a major, the vector-borne diseases in terms of, causing morbidity, mortality. And then the next comes to schistosomiasis and the lymphatic filariasis. So you can see that when the program is planned, depending on the prevalence of these diseases, that you can prioritize based on the prevalence and also the burden, so that we can prioritize the diseases for the control of the specific diseases. So this is the list of vector-borne diseases. This is at the global level. So there are 18 diseases which are vector-borne diseases, and of course all are not present in India. And coming into the mosquito-borne diseases, so there are at least 8 diseases which are caused by the mosquitoes. And in fact, controlling the mosquitoes definitely will be able to control these many vector-borne diseases. So then what is the current scenario? Because if you see, still we do have vector-borne diseases, and these diseases are emerging, some diseases are re-emerging, some diseases continue to persist in spite of the control measures. So this is because whether control or elimination or prevention is becoming difficult because of these many factors. One is the transmission is so dynamic because the disease involves a host, a parasite, a vector, and environment. So it is so dynamic. So if you just look at the point of intervention you can do in the cycle, but at the same time, there are certain limitations. And also, since it's a dynamic process and the transmission varies over a period of time and also at different places. So it is more localized due to the risk factors because after all, the disease are prevalent because of the local risk factors, and because of the risk factors, the disease, it's increasing in a given area. Then other thing is, of course, when the disease occur, then we need to take certain measures. But unfortunately, we are not able to have the timely action. What we do is, for example, we have the guideline and we simply transpose those guidelines, those intervention measures, those strategies to all the areas, irrespective of the analysis of the local situation of risk factors. And of course, now mostly vector-borne diseases, control of vectors, mostly we depend on insecticides. And we know that now the insecticides are becoming very expensive because of the limited number of insecticides available. Then lack of community awareness and acceptance is one of the major issue because there is no demand from the community. So we need, we realize the need for the programs, but the community doesn't have any kind of the demand. Then other important thing is for vectors, we have a resistance to insecticides. On the parasite, the response to the drugs is also less. So that means there is a number of parasites having resistance to the available drugs. Then shift in priority, the scarcity of funds, and then expensive modern tools. For example, we know that RDT, that rapid test kits or diagnostic test kits are available, they are very expensive. Then inadequate utilization of available tool. We do have a number of tools, either diagnostics or the treatment and case detection. So, but these tools are not fully utilized. Then indiscriminate use of insecticides, a lack of quality control. This again, it reduces, the impact of the vector control measures and also the parasite detection and treatment. And then hurdles in the development of the new tools, because new tools, there is not much demand for the new tools, and the initiative for the development of new tools is also not that much, it's not encouraging. Then simultaneously what happens is the program becomes fatigue because it has been, we have been carrying out for years. So then coming to vector control definitely has a major place in these situations to control the vector-borne diseases. First of all, if you want really have case detection and treatment, so we need to have the drugs. Suppose if you don't have the drugs, at least you should have vaccine. So there are many diseases we don't have today, and also the vaccine for the treatment or for the protection. And then same vector for more than one disease. For example, Anopheles in African countries, for Aedes mosquitoes, for different viral diseases. So if such is the case, instead of targeting the disease, so if you target the vector, so it will be cost effective. Then of course, foci of unknown infection, and when you can relate to the vector abundance, then of course that is a place where you have to initiate certain action for the control of the vectors. Then control of epidemics, definitely yes, because we have to prevent the transmission. So for that, we need to have that. Then prevention of epidemics to reduce the elements of the transmission. So vector control is very important. Then reduction of transmission areas of high drug resistance because your case detection and treatment is not going to help. Elimination of new foci of infection because the new foci means everybody is susceptible, and vector control and preventing transmission is very, very important. Then control of transmission, high risk situations, particularly where the people congregate, they're like a resettlements, migration, mining. So there you have mix of people, the people having the infection with the parasites which are resistant to drugs and things like. So under that situations, vector control has significant role. Then control of an epidemic disease, because when the disease becomes endemic, so what happens, most of the people remain asymptomatic, our case detection treatment is not going to be useful. Then zoonotic diseases, and again you have to interrupt the transmission, and for that vector control has a place. Then integrated vector control measures that should be prioritized over a move to, say for example, JE, we have the vaccine, but the target or children, but at the things there is a move to vaccinate adult population also. So such circumstances, definitely vector control is more valid. Then coming to the evaluation of the different strategies of vector control, in 1983, integrated vector control concept or strategy was introduced. This is nothing but um, integrate more than one appropriate measures to control vector. In 1992, selective vector control strategy was introduced. This is instead of doing everywhere, doing everything. So we have to be selective in selecting vector control, in selecting the vectors, the targeting the season and things like. So this concept was introduced in 1992. Then in 2000, comprehensive vector control, because so for different diseases, we have different parallel vector control, the element. And so that will be a duplication of efforts. So if you just bring all the thing under one umbrella, so we'll be able to control more than one disease with the unified, management structure. Then of course in 2004, now this integrated vector management was recommended by the WHO. Then, of course, recently we have a global vector control response. This is mainly based on the integrated vector management, but it's more of a kind of management. Then what is integrated vector management? It's nothing but a rational decision-making process. It's nothing of more technology involved. It's more of a decision-making process because we have limited resources, and how best these resources can be used. So by definition, integrated vector management is a rational decision-making process for the optimal use of resources for vector control. Then its goal is to make significant contribution to the prevention and control, because what we do normally is that when there is a disease, there is an outbreak, then we initiate certain control measures. But IVM proposes some preventive measures. So there is a place for preventing the infection and also preventing the resurgence of infection. The other important aspect of IVM is that we need to have institutional arrangements because we need infrastructure. That is very important. So with the available health system, how best we can make some arrangements. Then regulatory framework is very important to implement that. Then decision-making criteria is very important because evidence-based decision is very, very important. And procedures that can be applied at the lowest administrative level, for example, the village or the PSC, because all the risk factors are much more of a spatial than a temporal and things like. So the program managers also needs a decision-making skill because it's very important. IVM, the promotes intersectoral collaboration. So we need to have that kind of a skill for the program managers. Then finally, the cost effectiveness of vector control is a central part of the integrated vector management. If you see that really do we need IVM? Yes, definitely. There are few aspects which justify that integrated vector management. Normally what happens, we just look at the vector and the parasite. So we don't look at the human factor, we don't look at the environmental factor, but the IVM is emphasized on the social and the environmental determinants so that we can have the appropriate strategies to control and prevent the infection. Then other thing, for example, when you have an outbreak, and if you have certain strategies to control, and then once the control is achieved, what happens is that we will not have much any further activities. But IVM suggests the strategy is useful in consolidate and sustain the achievements which we have um, done using a particular intervention for a particular disease. And this is one of the important thing for the global malaria program. So the other important thing, as I mentioned, that over reliance on the chemical control methods, because we know we want to have immediate effect, either use IRS or use ITBN. So we use insecticides. It means that we depend more on the insecticides, even for example, BTI in the case of controlling the breeding of the vectors. So it means that IVM gives an option of going for non-chemical based methods. Thereby, we can reduce the over reliance, and also from the environment point of view, I mean that it's safe to use or minimize the insecticides for the control. Then we have limited options of insecticides, so that we have to think of how judiciously we can use these insecticides, and IVM gives a scope for that. So the key elements of integrated water management are, first is integrated approach. When you talk about integrated, it means integrating the different methods of control which are appropriate. It means that we can use more than one vector control measure, and the control measure can be against the the immatures or the adult. This is one. Second thing is, it also IVM focus on covering all the diseases which are prevalent in this particular area. So it is a multi-control disease control approach. And if even within the same disease, for example, malaria, if you have more than vector, so more than one vector, so all the vectors will be covered. So multi-disease, multi-vector, and integration of the vector control methods. That is one of the approaches. Then evidence-based decision making, because it is not like transposing the vector control measures. So we have to look at what are the risk factors, and look at the data on the prevalence of the vector, the behavior, then decide on which is important, which can be useful for a particular situation. That's based on the vector ecology, behavior, and things like. Then collaboration within the health sector and the other sectors, because the health sector, our responsibility is take care of controlling the vector-borne diseases, but unfortunately the other sectors, through their activities, the mosquitogenic conditions are created. So unless otherwise they are brought on board, that will be very difficult. So collaboration is one of the key elements of the integrated vector management. Then advocacy, social mobilization, and legislation. This is very important component in the integrated vector management, and capacity building of the program managers. It's very, very important. Then if we just see the concept of the integrated vector management, any given area for that matter, if it is a PHC or if it's a village, then of course there may be vector-borne diseases or no vector-borne diseases. Like, so in a situation where you have vector-borne diseases, and we have to look at whether you have formal vector-borne disease control program. If you have formal vector-borne diseases control program, we have to look at whether it is effective. If it is effective, then of course we need to maintain the gain whatever we have achieved, and enhance the effect or impact if it is necessary to that situation. Then if it is not effective, then we have to replan, and IVM is the strategy which is a choice to that particular situation to improve the effect of the vector control programs. Then if you have no normal formal program, then of course we have to initiate the vector control measures, and integrated vector management can be the choice for that. Suppose in case you in a situation where we don't have any disease, then it means again this IVM will be very useful, because it recommends some kind of surveillance, watch over to the situation on the vectors and on the occurrence of the disease and things like. Suppose in case if the established vectors are prevalent without any disease, and then we have to have some kind of check over the vector population so that we can prevent the introduction of the diseases from other places like. So coming to planning and implementation, of course, there are 8 aspects. One is the disease situation. First of all, we need to know what is the situation of the disease, vector-borne diseases in that particular area. Then, of course, local determinants of the disease in that particular area. It means we'll be looking at what are the risk factors, because all the risk factors we have to, address. Then selection of the vector control methods. Then requirements and resources. Program requires certain, the resources. Then implementation strategy, generating an evidence base, and vector surveillance, and finally monitoring and evaluation. So when you plan vector control, integrated vector management, uh, in fact, there is a difference between vector control and vector management. When you say vector control, this is mostly controlling the vectors in terms of either reducing, the survival of the mosquito, or the birth, or interfering with the death of the mosquito. It means there are mosquito population, and you are trying to either, by killing the population, or by reducing, the immatures and things like. So it means use certain measures by which you can interfere with the birth or the death of the mosquito. So that is control. But coming to management, it's more than that. It includes control plus also some personal protection measures. So integral vector management suggests that we have to go for control wherever it is necessary, and the management measures, particularly the personal protection measures. So when you plan integral vector management, then of course your target is that which diseases and vectors will be the main targets for you. And then what are the main vectors? Because you may have a number of vectors, number of diseases, then you have to prioritize. Then mapping, it means that at the population level, subset of population who are at risk. And then the area, it's a spatial, the analysis of the prevalence of the infection. We have to see that so that we can identify the areas for targeting. Then generating an evidence based. So we need to have generate evidences, and also these evidences can be, strengthened at different levels. Then vector surveillance, it's very important. Then what are the methods and what mechanisms to collect these mosquitoes? Then what strategy we have to follow for vector surveillance? And finally, the monitoring and evaluation. Then it's a process and the impact. Process means the performance of the program in terms of, the activities, and the impact is on the disease. So the planning cycle, you have two. Number one is the technical, and the other is operational. And the technical, of course, you have the disease situation. When you want to see the disease situation, of course, the first thing is the epidemiological assessment and the vector assessment. And also, when you have these parameters, then we need to stratify the area in terms of the risk. So this is the first aspect of it. And disease situation, as I mentioned, then it includes epidemiological assessment and vector assessment and stratification. And epidemiological assessment, of course, we need to look at the incidence or the prevalence depending on the infection. This comes from, the hospital records or maybe some special surveys. And vector assessment is very important. The presence or absence of the vectors, and if the vectors are present, their biology and the ecology and the behavior, that we need to know that. Then once you have this information, then of course we have to stratify the area so that we can prioritize the areas for the intervention, or which requires immediate attention and things like that. That's very important. So coming to entomological, what we have to do is that we have to look at the available data on the biology, ecology, and behavior of the relevant vector species which are present in this area. Suppose in case if you need more information for that particular area, we need to conduct rapid epidemiological surveys. And third aspect is the sites of disease transmission to confirm indigenous transmission versus imported cases, because that's very important. The infection may be there, the people may have the disease, but the thing is whether you have evidence for the local trans, that's very important. So by doing some surveys and also looking at the vector infection, so we'll be able to say whether it is indigenous transmission or imported cases. Then also though IVM, recommends minimal use of insecticides, but certain situations we have to depend on use of insecticides for the control. Then such is the case, then we need to know what is the status of the response of the vectors to the available insecticides, local vectors. Then, of course, this is very important for planning vector control strategies and also choose more effective methods for that particular situation. So there are 5 aspects on the assessment of the vectors of a particular disease. One is ecosystem where they are component. For example, ecosystem means that what are the different kinds of breeding places and how these breeding places are influenced by the environmental factors. Then role in disease transmission, it means the vectors may be there, but it may not get involved in the transmission. So we need to have evidence whether they are really involved in the transmission. And then habitat and seasonality, or the different types of habitats we have. What is the seasonality? That is the temporal variation in this, all this. Then behavior, it's very important, particularly when you target the adult mosquitoes. So that's we need what is the feeding pattern and feeding preferences and resting. Then susceptibility to insecticides is very important. These are the 5 important components under the assessment of the vectors. Then coming to stratification, this is very important. So we know that we make the maps using the incidence. This is an example for malaria. So similarly, we can make certain maps for the rest of the diseases. So here, if you see, it is based on the API, and other diseases, it can be on the disease or maybe the prevalence. Also, we can make the maps using the vectors, the distribution of the vectors. And also, we can have an option of making maps using the land use pattern. So these are the 3 maps you can make. One is epidemiological, the other is ecological, and third thing is the vector. So when you see this for a given area, you can make a kind of overlapping, these different maps. You can identify which is the place requires immediate attention. So this is an example of stratification. The first level is that based on entomological parameters, we can make the area as receptive or not. So the first classification. And second classification is that, of course, in area where it is receptive, then we can say whether you have malaria or not. So receptive with no malaria, receptive with malaria transmission. Then further classification of malaria, with malaria transmission. So it can be, so maybe based on the distribution, there may be some malaria active foci and some, of course, no malaria cases like. So this is the third level of classification. Fourth level of classification in the malaria, without a definite, foci, that means entire area is endemic. So those areas we can classify based on the level of transmission. That is in terms of the incidence. It may be low transmission, high transmission based on the API. So this is how we have to make the stratification. So once you identify what diseases are prevalent in your area, what are the vectors and their behavior and the breeding places, and also you can make a stratification. Now, of course, you have a map for targeting the control of the vector-borne diseases through vector management. Then we have to, suppose in case you have identified certain areas where you need attention, where there is a risk of transmission, then of course in that particular area, we have to identify what are the local determinants of the disease. It means what are the factors that promotes the transmission. That is the second aspect. So of course we know that the factors are, you have the human factor, we have the environment, and we have the vector, and we have the parasite. These are related, and finally, because of the close interaction with these factors, so you get the disease. So we need to identify these factors, we have to rank them, we have to map it, we have to tackle it, and we have to prepare a seasonal calendar, because all the risk factors will not be the same throughout the year. So we have to make the seasonal calendars, and based on that, you have to decide it. So the identification of the determinants, of course, as I mentioned, one is the parasite factor and the vector factor is very well defined. You have the case detection and treatment procedures and strategies, and vector control procedures we have. But unfortunately, what happens is human and environmental determinants are largely missed in our assessments, because this is very important. The human, particularly the sociological factors, human behavior, human, the demographic factors are very important, and also environmental determinants, because it's more dynamic process, and that is the one which really leads to the creation of the musculogenic condition and things like. So it's very important to have the expanded assessment of the human related, environmental related determinants. Then coming to the different the aspects of determinants, parasite related determinants, or the parasite pathogens that cause the disease, and what is the status of the drug resistance. That's very important, whether the area really have the problem of the parasite having the drug resistance. So we have no alternative option than the vector control. uh, then, of course, this can be done by the epidemiologist. Then, vector-related determinants: what are the main local vectors, and where and when do they breed, and what are the densities, and all the other characters of their feeding and then resting behaviors. Then human-related determinants. In fact, this is one which, in fact, we need to understand. First of all, the distribution and structure of the population, who is vulnerable to it, where do the vulnerable group live, and whether they live close to the breeding places, and where do the people meet, because that is a place of congregation where the possibility of the people having the infection. So particularly, the fisherman movement, when they move from one place to another, so these are the places where we need to have close monitoring. Then what are the patterns of population movement? Say, for example, migration. Then what are the local practices and the altitudes towards vector-borne diseases? And what are the domestic conditions of the population, particularly whether it is suitable for insecticide application? And then income of the population. It means whether they have the capacity or for cost sharing for some measures. Then do people serve as a reservoir of diseases? And what is their access to treatment? And what is the effective medication they receive? So these are some of the human related aspects. So once you identify this, then of course you have to map it. So mapping can be done like this. It means that mapping can indicate where the people live. It means the residential areas, and then patterns of movement, then infrastructure like roads, locations, etc., vector breeding sites, then service providers, that is the location of the service providers, like for example the PSCs or subcenter like, and then vegetation and water bodies. So these all the determinants which can be mapped, and based on that map that we can develop the strategies, and not only developing strategies, identifying vector control measures, also the implementation. It means allocating areas for interventions. Then, of course, tackling the determinants, it's very, very important. As I mentioned, that we'll find out where and when these risks are present, and the identify the communities which are vulnerable to this. And again, the determinants can be modifiable and non-modifiable determinants, and modifiable determinants, definitely that we can have certain measures to tackle it. But the not modifiable diseases, the determinants. So, like for example, rainfall is one of the factors, but at the same time, so we can anticipating the level of rainfall, then we can have certain plans. And certain determinants are outside the scope of health department. For example, the agriculture department, the paddy field, and things like. So these are some of the areas where the other sectors are involved. Then coming to selection of the vector control, so we have to look at the available methods already present, and within that, so we have to select the methods, and also we have to keep in mind the multiple diseases, because IVM targets all the diseases, vector-borne diseases in that given area. So we have the different options, of course, inter-residual spraying, and we have space spraying, and we have larviciding, we have biological control, environmental methods, physical methods of control, personal protection measures. Because I'm not detailing this, because you are aware of all these methods. Like, so this is of course a different, the points of intervention in managing the vectors of vector-borne diseases. So this also I'm not going to elaborate, because these are the points, these are the different, the methods which are available. either immatures or the adults based on the behavior like. So this, if you just see that, these are different categories of the vector control, environmental, mechanical, biological, and chemical, and these are all the different methods under environmental and methods of control. So if you see the different diseases, you have Chagas disease, you have dengue, trypanosomiasis, and Japanese encephalitis, leishmaniasis, lymphatic filariasis, malaria, mucormycosis, schistosomiasis, trachoma. So these all the diseases. These are the diseases. So then we have to see that which method is useful for the different diseases which are prevalent in that area. For example, in a given area, you have dengue and lymphatic filariasis, Japanese encephalitis, malaria. Then what method will be the best method like? So it means the method which covers or takes care of all the vector-borne disease in that particular area has to be considered. Also, we can add more methods depending on the vectors available in that area. So coming to Indian situation, of course, we have dengue, Japanese encephalitis, leishmaniasis, lymphatic filariasis. These are all the different options you have. So we have to see that which method covers most of the vectors of these diseases. Then coming to the selection of the vector control options, it should be based on the priorities of diseases, the local needs, because there may be, the needs may be different to different situations. So maybe the resources, available resources we have, then existing infrastructure, these all the aspects which you have to consider. Then also the method and the insecticide, if you use, it should be safe, cost effective, because if you implement all the methods, definitely it's going to be effective, but there should not be any kind of duplication of effort. So we have to see which is most cost effective method, and that method has to be implemented. And also it should be very simple to understand by the community and also for use. Then should also encourages the use of the involvement of community. So here, if you see that the other aspects of in the selection of the vector control measures, so we have to look at the safety, we have to look at the effectiveness and the risk of resistance to insecticides, possible scope for community participation, affordability, and then logic and policy support. And also, finally, we have to make a selection. So it means for each one, you have to give a score. So we have positive and negative. For example, the risk of developing disease is a negative aspect. If the safety levels are more, that's again you have to negative aspect. So considering this, so you can put some score, and finally you can make a selection. For example, here the selection is more on environmental and of course the chemical like. So for putting 1 plus and 2 plus 3 plus, so we can give some score and finally you can make a selection. So this is a selection process for integrated vector management. This again, it's a matrix which shows that the different diseases combinations. So situations where you have malaria and lymphatic filariasis, or malaria, lymphatic filariasis, and JE you have something like that. So different combinations you have, and here this column shows the different the methods for controlling the vectors. So depending on the vectors of the disease, then we can select the methods. For example, when I coming to the dengue, so dengue you have malaria and dengue, so definitely it will be insecticide treated structures will be very useful in controlling something like that. So you have to make a selection using the different available methods and also the diseases which are present, and again you can prioritize based on the population. For example, malaria and lymphatic filariasis, you have these many million population, but at the same time lymphatic filariasis and dengue you have the higher population like. So you can prioritize based on the risk population, based on the presence of the vectors in that particular area, and also the available methods. So this exercise is very important to make in integrated management. Then coming to the multiple diseases situation, so here, of course, three vector-borne diseases like you can say malaria, lymphatic filariasis, and dengue. So these all the diseases which are prevalent in that area, and you target these diseases. And for each disease, of course, you'll be identifying the main vectors. So maybe for disease malaria, so you have only one disease one vector like Culissifasis in your area. For disease B, So you may have to, the vectors may be, for example, for dengue and chikungunya. So we have Aedes albopictus and Aedes aegypti, things like. And C, you have only one vector. So these are three diseases, but you have four vectors. Then also you look at what are the available methods for this particular vector. So you have option 1 and 2, right? So option 1, so maybe the source reduction. Option 2, maybe indoor-terrestrial spraying. And for disease B, so you have three options. So you have additional one more method. You see use of like Larivirus fish or something like that. So for disease 3, so you will have use of Larivirus fish is common here, and you have one more additional method. So these are the different options you have. Then finally, under integrated vector management, you have to select one method or combination of the methods which are effective in controlling the vectors of these diseases. It means it may be more than vector of a given disease or all the vectors of all the diseases. So this is the basic concept of integrated vector management. This is mostly a selection process. Identify the disease, identify the vector, then look at the available disease, methods, and finally you have to select which will be more cost effective. Then coming to resources and requirements, and what you need is a financial, human, and technical. When you say human, it is the resource, the manpower. So then also we have to look at the resources from other sources. Like for example, national program for vector-borne disease control is mostly on the policy and the technical. They provide guidelines. And then district health offices, it's more of a decentralized, particularly in terms of financial support. The local government, they can have additional funds. Then other public sectors, also policy, agriculture, or maybe public works and things like. So they may be able to give some fund, or maybe they may be able to help in making the policy for integrated vector management. Then private sector, mostly manpower. NGOs, they have manpower and do that. So the civil society organizations, the voluntary organizations, we can do that by implementing public-private partnership strategy. And then community, definitely, yes, it is very important, their participation, and they are one of the major resources. Then capacity building is also very important. So these are some of the potential resources which can be utilized. Then coming to implementation strategy. So having done the situation analysis, identifying the risk factors, selection of the vector control measures, ensuring that you have adequate resources, then of course we have to have an implementation plan. And when you make an implementation plan, that we have to fix the targets, and you have to identify the activities, you have to spell out the activities, and when, where, and how much, and how frequently, and things like. Then roles of the health system, other stakeholders in different activities, and also responsibilities for implementation. This we have to define. So these are some of the areas for different, the interventions or vector control management measures. Like for example, here, these are the targets, and when to implement, where to implement, and who should implement, and responsible body, and who should monitor and evaluate. So all these things in your plan, you had to make it out, suiting to the disease, suiting to the vectors which are available in that particular area. Then coming to generating evidence base, this is very, very important. And there are two types of evidences we'll be looking for. One is that which really uses or have a basis for selecting a particular vector control measures, and then a kind of feedback. It means that once you selected measures based on the evidences, particularly on the breeding sources and behavior, you are implementing the vector control measures, and we need to know what is the kind of impact we have. So the evidences are for developing vector control measures and also for assessing the impact. So this is very important. And it means that, as I mentioned, establishing vector control measures and also maintaining the whatever the impact which we have. And this is an example of the evidence base. What do you require? For example, if you really opt for indoor-terrestrial spraying, then we need to know that. So we need to know that whether the local vectors rest indoors, and then whether vectors or the vector is repelled by the insecticide used, whether the people leave sprayed areas intact. These are the informations which are really necessary for opting for industrial spray. Then coming to the insecticide treated bed nets, whether the local vector bites indoors, because outdoor transmission and outdoor biting mosquitoes, it may not be useful. The local vectors are anthropophilic. It means that prefer to feed more on human. Whether the vector is repelled by the impregnated insecticide, whether the people use nets or they maintain properly. These are the informations which we need or evidence based for selecting this particular intervention. Then, of course, when you have the evidence based, this evidence based, if it is generated at the village level or the PSC level, then that has to be shared with the district level, state level, national level, so that we'll have some kind of information base for the vectors and the behavior. Then vector surveillance is another important aspect. It means that we need to monitor the vectors in terms of the density, in terms of their behavior. So space and time, and we know that we have the strategies, and the global technical strategy 2016 to 30 outlines 5 core vector control elements to accelerate progress. One is to maximize the impact of vector control. We do have vector control measures, but we need to maximize the impact. Maintain adequate entomological surveillance and monitoring, because that is a kind of inbuilt component in the program itself. Manage insecticide resistance. We have periodically look at the susceptibility of the vectors to insecticides, and whether there is an indication for the change of insecticide is very important. So it should be a kind of continuous process. And manage residual surveys, residual transmission. For example, if you come across some pockets, some foci of transmission, that we have to tackle it. Then strengthen capacity for evidence-driven vector control. So entomological science is central to all these 5 elements. So here now there is a tool available. Entomological surveillance plan tool is available for malaria, and that helps in planning entomological surveillance activities, interpreting the entomological data, and then guiding the program for decision making. So the priorities of entomological surveillance, they also have certain indicators and related activities across transmission settings and geographic areas, levels of program capacity. So this, in fact, this booklet is now available, so you can download this. This gives you a complete, the surveillance strategies, the importance of surveillance strategy, how to do, when to do, what are the collection methods and things like that. You can download this, and it is really good, on the vector surveillance. This is mainly focusing on the malaria. So these are the different modules available in that. Then these, of course, the different the mosquito collection methods. I think probably that vector surveillance class, they would have handled it. I'm not elaborating on that. Then finally, monitoring and evaluation. This is very important component, because we know any program, control program and things like, so we need to have monitoring and evaluation. That is an inbuilt component of any program for that matter. So it means monitoring is more related to process. It means how much work we have done, what are the activities we have done, whether these activities are sufficient enough or against the plan. So that is very important. And evaluation is nothing but the impact. So monitoring involves examination of the cause, and then evaluation involves analyzing the effect of a particular intervention, or nothing but what is the impact, what is the outcome. So we have certain inputs, and we have certain the outputs and outcomes. Outputs is in terms of activities, outcomes in terms of impact. So these functions of this monitoring and evaluation is actually it helps or guides in planning and measure the impact, areas requiring the improvement, and also to account for the resources are used. And also it gives some kind of the database for understanding the relations between performance of activities and also the observed outcome or the impact, and it gives us an opportunity to look at the gaps and weaknesses so that we can improve. So this is a simple thing. So we have certain inputs in terms of the insecticides or the manpower and things like. We have a process of using this inputs and doing certain activities. That is the outcome. So the outcome in terms of integrated vector management is the reduction in the vector population or change in the behavior of the vector population. That is the outcome. So this actually is a part of the cycle of transmission point of intervention, and that relates to the impact. So this is how monitoring and evaluation we have to do that. So this is a simple model. So we have certain processes by activities that you can reduce, the vectors and vector behavior, and the density you can measure in terms of the density or intensity of transmission, and finally outcome is on the morbidity and mortality of a particular disease. That's it. Thank you.